My name is Lisa Tillman, and I'm the Executive Director of Rifa in downtown Jackson. So the pandemic has certainly altered the way that we do business. I think it's altered everybody's lives in ways that we probably could have never imagined, this time last year. As far as the way things have run at Rifa, we've just constantly had to adjust the way that we do business and the way that we deliver services based on the changing landscape and the changing environment and whatever mandates are in place at the time, and also take into consideration what's best for the health and well-being of the people that we serve and our volunteers and our employees. And so since the pandemic hit back in mid-March, we've had to make a lot of decisions, change the way we do business, pivot, adjust. But we have continued to remain open every day since the pandemic hit Jackson. We have continued to deliver services, sometimes in a different way than we've done in the past. We have seen an increase in services, an increase in need, but thankfully we have, like I said, been able to stay open every day and continue to try and help alleviate hunger in our community. Rifa's mission is about fighting hunger in our community. We do that through many different programs and services. We have a soup kitchen that's open 7 days a week. It's a no questions asked kitchen, so anybody is welcome to come and receive a meal. We serve breakfast and lunch 7 days a week, and we serve a dinner meal 2 nights a week. We have a food bank where we distribute food to other nonprofits in our community and in West Tennessee, nonprofits that feed people through the work that they do. We have a food pantry where we distribute food to individuals and families that are struggling with food insecurity and sometimes just trying to stretch their dollars through the end of the month. We have a snack backpack program where we provide food for Saturdays and Sundays for elementary school children throughout the school year. And then on fall break, spring break, and summer break, we have the Bus Stop Cafe that goes out into some of the more at-risk local neighborhoods to provide food for actually children ages 0 to 18. We have a couple of food co-ops. These are small groups of people that meet a couple times a month. The idea is to build community amongst that group, and they actually leave with about 1/3 to 1/2 of the food that they need for the month. We have a seniors program where we work with senior citizen centers in West Tennessee. We are currently serving about 400 senior citizens every other month through Senior Staples. We have a thrift store where we provide gently used items to the local neighborhood. It is open to the general public, but it is targeted at our local neighborhood. So early on, when the pandemic hit, we had some real concerns about the people that we serve through the soup kitchen. These are people who already struggle with health issues, diabetes and heart problems and asthma. And so we knew that, and again, this was early on before there was a lot of, we know so much more about the disease now, but we knew that we did not feel like we could provide a truly safe place for them to come and eat. Again, this is pre-social distancing, pre-masks. And so we closed the kitchen early on during the pandemic, which was a really tough decision because for the people we serve in the kitchen, it's not just about the food, it's about the community of coming to the kitchen every day and being with one another, people who are oftentimes isolated, whether there's a pandemic or not. These are people who are isolated, sometimes living on the streets, sometimes living in a home with no utilities. So again, it was a really, really tough decision, but we felt like overall it was best for, again, the people we serve and our employees and our volunteers. So we had to kind of pivot and provided those folks, the people that would normally come to our soup kitchen for a meal, we provided 7 to 10 day food boxes that they could come and receive and take home with them. And even with that, we had to take into consideration, was this somebody who was homeless? Because that food would look very different than somebody who was living at, say, McMillan Towers. Or were they living in a tent? We had to take all of that into consideration when trying to determine what type of food to provide to them. So again, lots of shifting and just trying to adapt to the environment. Another thing is that our bus stop cafe was actually on the road for spring break when the pandemic came to Jackson, and the schools did not return after spring break, and so the bus stop cafe just stayed on the road from the middle of March all the way up until the end of August. So that was not something we were necessarily prepared for. You've got to have a bus driver, you've got to have somebody to work on the bus, you've got to have the food to distribute on the bus, and so again, just a couple of examples of how things looked differently or how we had to adapt. The people that we serve at Rifa are resilient in so many ways, and they've been really great about just kind of adapting again to the changes that we've had to make. Now, has it been a struggle for them? Yes, it's been a struggle for all of us, but they've been really good about, just making the best of the situation, which is certainly not optimal, but they are, like I said, they're resilient people to begin with. These are people that have struggled before the pandemic, and unfortunately for many of them, they will continue to struggle because they are caught up in that generational poverty. So many of them are struggling with substance abuse and mental health issues. So these are people who have struggled for a long time. As far as the community and the general community and their response to the work that we are doing, it's been overwhelming and humbling. The community has just been really awesome in their support of the work that we're doing. We have had a little bit of a struggle with volunteers, but that's to be understood based on the situation that we're in right now. But overall, like I said, it amazes me that we've been able to stay open every single day and continue business as usual, even though it may look a little different than pre-COVID. To be honest with you, we really haven't had time to think long term. We were actually literally in the process of updating our strategic plan, and the meeting that we had scheduled on Friday, March 13th to work on our strategic plan shifted to how are we going to respond to the pandemic. And the honest truth is we have not had time to think very strategically. Hopefully, after the first of the year, we can sit back down and have some very deliberate and thoughtful brainstorming sessions on how do we want to move forward. But for us, we've had to adjust in how we deliver our services, but I think we feel good about the services that we were delivering pre-COVID. So to answer your question, there's not anything really a new initiative that's come out of this per se, but we certainly are always looking to be better than we were last year. So we'll continue to try and do that. To say I'd like to see things get back to normal, I think that's probably a wish that we all have. It's hard to even imagine what things are going to look like post-COVID. We just want to continue to do the work that we've been doing for years and years and years, and that is to work to alleviate hunger in our community. And we know that, hunger is just a symptom of a much bigger issue. And so if we can be a part of that in any way, we would love to. We know that poverty is an issue in our community as it is in communities all across the country. Rifa's mission is not to solve the issue of poverty. It's to help alleviate hunger for those people who are battling poverty in a lot of cases. For some people, it's a one-off. Maybe they've been laid off from their job and they need a little help until they get another job. But for most of the people that we see and that we serve, these are people who are caught up in long-term generational poverty. for various reasons. And again, a lot of the people that we see and that we serve are battling substance abuse issues and mental health issues. And again, that's not what Rifa's mission is. So I would just love to see, our community, our country, our nation, things to get back to normal. But again, I don't know what normal is anymore. And I think we've been caught up in this for so many months now. I think we're all just exhausted. I have learned, I have been reminded of what an amazing community that we are a part of. Rifa is a very grassroots organization that has always been supported primarily by our local community. We don't typically get big, huge federal grants or big state grants. That's not the way we operate. And so it's been, again, very humbling and very refreshing to see how the community, in the midst of this pandemic, when I know a lot of people are struggling, people have lost their jobs, people have lost loved ones, that they continue to step up and support the work that we're doing and invest in our mission. I've got a really great group of people working at Rifa. There's a great team that's been assembled there, and they have risen to the task of working through a global pandemic. So I'm really proud of them. And I've learned the term decision fatigue. That's a real thing. So early on, there was a lot of decisions that were having to be made. Our leadership team was meeting sometimes multiple times throughout the day in those early weeks. And there's definitely fatigue that comes along with having to constantly shift and adjust and make new decisions or change the decision that you made an hour ago. So. We have. But of course, there's been, stimulus money that's been put out into the community. I was actually talking with my son yesterday, who works for a much larger nonprofit, and they're actually predicting next summer is going to be the time we're going to see a big, maybe a surge in need. And so that's kind of given me something to think about. Like I said, there's been unemployment benefits, that $600 additional unemployment money. You've had the stimulus checks that have gone out. There's just been so much money infused into the community. So I'm not sure, while we have seen an increase in the need for our services, I'm not sure we've seen that, I think that there's more to come, probably a lot more to come, actually. Again, there's been a lot of money that's been put out there, a lot of relief money that's not going to be around forever. Based on the people that we see on an ongoing basis, they're pandemic or not, there are much bigger issues that need to be addressed. And I will say that I think that there's a really positive trajectory in the community now with the Anti-Poverty Task Force and, the work that Matt's doing here at United Way and the work Lauren Kirk is doing at the city. And, I was on a call just a couple days ago about a mobile farmers market to serve some of the communities in our city that, maybe struggle with transportation. I think Matt's done a great job with the weekly United Way Zoom calls, and I have been really impressed by the Facebook Live that the health department does and the sometimes very entertaining Facebook Lives that the mayor does, but that's really great. That's being very transparent and working really hard to have good, clear communication and messaging, which I think is important.